You've been recommended you need a knee replacement. What happens next? Ultimately, that decision is made as part of a shared decision-making process with you, the patient, and me, the consultant. Once a decision has been made that a knee replacement is required, the time scales around about 6 weeks before we schedule your surgery. The next step would be for you to see the pre-operative assessment nurse. This is a nurse-led clinic that will determine your fitness for surgery and optimize any medical conditions so that you're in the best possible shape. This involves not smoking, even if you can stop smoking for 2 or 3 days before surgery. If you drink more than the recommended 14 units of alcohol in a week, it's also important to lower this as well. On the run up to surgery, keep well hydrated, particularly the day before. Your preoperative nurse will give you a body scrub, which you need to start using 5 days before the day of your admission. And you have to stop eating 6 hours before your admission time. Drink clear fluids up until 2 hours before your admission time. On the day of the surgery, you will get admitted by the nurse on the ward and get changed into appropriate gowns. During the operation, I also inject lots of local anesthetic and anti-inflammatories around the knee joint, which then gives you tremendous pain relief. What this means is that you're able to get up and walk that afternoon with the physiotherapist. The surgery itself typically takes about an hour or so. This is for a partial knee replacement or a total knee replacement. Usually patients are in hospital for about 2, maximum 3 days following a knee replacement, and then 1, maximum 2 days following a partial knee replacement. You have this big bulky dressing that gets taken off the next day or 36 hours after your surgery, which will allow you a bit more freedom of movement. And I like to see my patients around 2 weeks after the operation, just to make sure that the wound is healing okay. You will need physiotherapy after the surgery, and at least once a week for 6 weeks, but you need to do regular exercises at home. The knee can persist in terms of swelling, and that's very important because patients get alarmed when they see me at 6 weeks and the knee's still very swollen. That is entirely normal, and as I mentioned, that can be 3 to 6 months before the swelling gets normalized. Patients often ask me what kind of activity levels they can do following a knee replacement, and it's important to remember that the total knee replacement or partial knee replacement is a pain relieving procedure primarily. It's important to look after your knee replacements because typically it lasts for 10 to 15 years, and the more you use it, particularly more impact stuff, the greater the chances are that the knee will loosen with time. It's important to do some gentle weight-bearing exercises like walking, but running typically we tend to advise against. Patients can usually start driving at 6 weeks. If you have pain, swelling, stiffness, disability from your knee and need a rapid diagnosis, please do get in contact with us. If you've been told you need a knee replacement, I'd be more than happy to give further consultation and advice regarding this.